As a cross-border retiree, one of the most difficult decisions that you have to make is what is your healthcare going to look like in retirement? Today, we're going to talk about the best healthcare plans available for cross-border retirees. Hello, my name is Brian Haggard. I'm a certified financial planner and chartered financial analyst. I'm the founder of Retirement and Financial. We help simplify your cross-border retirement plan. And with all of our clients, we start off with a 5 meeting process to develop a retirement plan for them. And one of those meetings is always to focus on what is their health insurance going to look like in retirement. For a lot of people, one of the reasons they continue to work is because they're nervous about what health insurance will look like once they leave. Today, we're going to talk about what are some of your options available to you. We're going to talk about what happens if you retire after 65. What are some of your options available if you retired before 65? We'll even look at some options if you snowbird, if you spend some time up in Canada, and also a little bit time here down in the United States. So, first of all, if you're going to retire after age 65, health insurance down here is pretty easy. Almost everybody is going to go on to US Medicare immediately. So, what is US Medicare? US Medicare is the retirement healthcare program here in the States. But in order to qualify for Medicare, you have to have worked in the States for at least 10 years. And you have to have earned 40 Social Security credit hours. We've talked in other videos about how there's this US and Canada totalization agreement and how it can help you qualify for different benefits by working in the US and Canada together. That's not the case with Medicare. In Medicare, you actually have to have worked in the US for a total of 10 years at least to qualify for it. Now, Medicare can start as early as age 65. And even if you've never worked in the States, you may still qualify for a Medicare program if you are a spouse of somebody who worked here in the States. Now, what's actually interesting about Medicare is if you are an older spouse, older than the spouse that was working here in the States, you could actually qualify for Medicare as early as 65, even if your spouse, who was the worker, is only 62 years old, as long as your spouse qualifies for Medicare. So you may never have worked in the US, but you'd still qualify for a Medicare benefit as long as you're 65 and at least as long as your spouse is at least 62 years old. Now, the cost of Medicare is based on your income. The more you've earned, the more higher that you pay for Medicare costs. Now, I have a whole Medicare video that I've done. I'll link it down here below so you get a little bit more information about exactly what Medicare looks like. But as you can see here, the more you make, the higher your Part B Medicare costs were going to be. So somebody who makes under 106,000 as an individual or under 212,000 as a joint married couple, the monthly benefit is as low as $185 per month for Part B Medicare costs. But as you can see, the higher your income, the higher those costs will go. The other interesting thing about Medicare is the costs are based on 2 years ago. So the 2025 Medicare costs are actually based on your 2023 income. So for a lot of our clients, when they first retire, their income was higher maybe 2 years ago. Now they're entering retirement, their income is going to go down. And when they initially qualify for Medicare, they get a letter from Medicare that their income, because of their income 2 years ago, they're going to face some pretty significant Medicare costs and penalties. If that is your case, you can actually dispute that through Medicare if your income is going to be lower now because you had a life event changing experience such as retirement. So it's really important that you do that if you get that letter from Medicare and if your income is going to go down. Now, the costs don't stop there. A lot of there's a lot of different Medicare plans and options available to you, but probably the most common one that our clients choose is a Medicaid Plan G. And Medicaid Plan G is going to run you on average an additional $135 per month. You're also going to need to buy a prescription drug policy under this plan as well. And the average total cost for somebody, according to Medicare right now, is about $375 per month. And I usually find that most people pay somewhere between $350 to $400 per month for Medicare per person. So if you're married, both you and your spouse would pay that. And you're also going to typically need to either buy an additional dental policy on top of it or work with your dentist to try to get lower costs on top of this. So Medicare is a great policy if you're over age 65, but for people under 65, you have to go for a different route. Now, how if you don't qualify for Medicare? In order to qualify for what is called premium free Part A, you have to have paid into Social Security for at least 10 years. How if you haven't paid into Social Security for at least 10 years? If you don't have 40 Social Security credit hours? Well, if that's the case, instead of Part A being free, you actually have to pay up to an additional $518 per month for Part A. So it is possible to still go on to Medicare, but now all of your sudden you're probably paying $1,000 per month or more for Medicare, not the $350 per month or so if you qualify for Medicare. On top of that, in order to pay for Medicare, if you want to get Part A and pay for it, you have to be a US citizen or a non-citizen that has lived in the US for 5 years or more. One of the questions we get from some of our clients is, hey, we're here down in the States. My parents are still up in Canada. Is there a chance that we can move them down to the States and get them Medicare? And the truth is that they probably won't qualify for Medicare, certainly not right away, unless they've been here for at least 5 years. So it can be a little bit tricky. I really recommend if you are going to retire here in the States, really want to make sure that you get 10 years of US work, or it's going to be really, really expensive retirement to pay for Medicare. Now, like I mentioned before, it's pretty easy if you're to retire after 65. If you already qualify for Medicare, in all likelihood, you're going to move on to Medicare right away. But what happens if you retire prior to 65? There tends to be three options that we see with most of our clients. One, you may be covered by an employer plan. Now, this has become more and more rare. A lot of employers have dropped the health insurance, the retiree health insurance plans to save money, but it is possible that you've worked for an employer for a long period of time. You may still be eligible for a retiree health insurance plan. If that is the case, you'd want to check with your employer. And for most people, if that's the case, it's probably going to be your best option if you retire prior to age 65. For most people, though, what they do is they go on to one of two plans. One's called COBRA insurance or ACA insurance, also known as the Affordable Care Act. So let's go through those. So the nice thing about COBRA is if you're working for an employer that has at least 20 employees, you are required by law, or they are required by law, to allow you to keep your current insurance for up to 18 months after you leave your employer. So that's a huge benefit to a lot of people. Now, that sounds great, be able to keep your current insurance for 18 months after retiring. The issue is that the employer no longer is putting any money into that insurance. So, for example, right now, your monthly premium payments through your employer might be $100, $200, $300 per month. And that's because the employer might be putting up to $1,000 per month to help supplement for that. Once you retire, that employer is no longer putting any money into that coverage. So sure, you're able to keep that coverage that you've had, but now you're going to be paying a lot more for it. A lot of times what I find is if you're a single individual, you're probably going to pay $500 to $800 per month for Cobra insurance. And if you're married for a family, you may find that your monthly amount premiums might be $1,000 to $1,500 per month. So Cobra insurance can be a little bit more expensive, but it can be a good option, especially if you want to maintain your current policy. Now, the issue with Cobra is it only lasts for 18 months. So if you're retiring after 63 and a half, you can actually go on a Cobra and it can get you all the way till 65. But if you're going to retire before that, there has to be another option available for you. The other option that is available for most people is what's called the Affordable Care Act, or ACA. Other people refer to this as Obamacare as well. So Obamacare has four different plans available to people in retirement. There's bronze, silver, gold, and platinum plans. The bronze plan is going to be the lowest monthly premium, but it's also going to have the highest deductibles. It's going to have the highest out of pocket, where the platinum plans are going to be the highest monthly premiums, but it's going to be the lowest deductible, lowest out of pocket cost if you actually need insurance. Now, the biggest thing about the Affordable Care Act is you want to know what your income is going to be in retirement. And tax planning is extremely important if you're going to go on to the Affordable Care Act, or ACA, because the monthly premiums are based on your annual income. The lower your annual taxable income is going to be, the higher tax credits you qualify for, and therefore the lower the monthly premium cost is going to be. I have clients down in Florida right now that are very well off. But what we've been doing is we've been keeping their taxable income under $50,000 per year. And as a result, they're only paying about $200 per month for a really good health insurance plan combined for both of them. So it's a really good program if we can keep your costs lower. I have other clients that are paying well over $1,000 per month because they have a little bit higher taxable income. That family down in Florida, what we're doing is we're withdrawing money mainly from checking accounts, savings accounts, brokerage accounts at very low cost, at very low taxes, where other families are having to take money out of IRA accounts, which may cause really high taxes or higher taxable income. So if you're going to go onto the Affordable Care Act, tax planning is really important. Now, you can get more information about the Affordable Care Act on healthcare.gov. You can go and see what sample costs would be for health insurance there. You would put what your income is going to be, who needs the insurance, and it will tell you what your credits you would qualify for and how much those monthly premium costs would be with the different insurance agencies in your area. But you are not be able, with your Affordable Care Act, you're not able to maintain that same insurance. Now, what happens if you tell Affordable Care Act, how they base your premium is you put in and say, hey, I'm going to make $100,000 this year. They're going to say, as a result of that, your monthly premium is going to be $500 a month or so, or maybe $1,000 a month, depending on your situation. If your income is higher than what you've told them when you file your taxes, you're going to actually have to pay more during tax time as a result of your income being higher. If your income is lower, you may actually get a larger refund back because it's lower than what you told them. So, like I said, tax planning is really important if you're going to go onto the Affordable Care Act in retirement. So let's kind of compare and contrast Cobra versus ACA. The great thing about Cobra is it allows you to keep your current insurance. You're able to keep your same doctors, your same prescription drug coverage in all likelihood. And that's a big benefit for people, especially if you're somebody who visits the doctors frequently. Maybe you have a deductible that you've already met. You don't have to go through a new deductible process. So the Cobra can be a big benefit there. Now, the problem with Cobra is it tends to be a little bit more expensive. ACA, you can maybe go and find a bronze plan, a really bare bones plan for relatively cheap. If you're healthy, you don't visit the doctor very much, maybe you're comfortable getting a bronze plan that has really low monthly premiums, but higher out-of-pocket costs. The other thing about ACA is, as I mentioned to you, right now there's potentially really large tax credits, and that keeps those health insurance premiums for some people extremely low. I've had people in the past get completely free health insurance through the ACA. So it can be a really great process. Now, all caveats aside here, 2025, the new administration, it's going to be interesting to see where those tax credits go. This was a big part of President Biden's administration, not so important right now under the President Trump administration. So it is possible in the years to come that some of those potential tax credits do go away. Now, overall, I would say that Cobra insurance is better insurance, meaning that you're typically going to have, a little bit higher monthly premiums, but as a result, you're typically going to have, lower out-of-pocket cost, lower, co-insurance policies, typically a little bit better health, prescription drug coverage. So overall, Cobra is typically just a better insurance plan for you. Also, with Cobra, a lot of times you can maintain the same dental and vision policy that you had while you were working. ACA, you may have to buy separate dental and vision plans. But of course, ACA can be a long-term solution for people where Cobra only lasts for up to 18 months. So, what are your options ultimately going to be? If you're going to retire after 63 and a half, you can go on to Cobra, be on Cobra for the whole time until Medicare starts at 65. Obviously, if you're going to retire after 65, in all likelihood, you're going to go right on to Medicare immediately as long as you qualify. If you're retired prior to age 65, or 63 and a half, you're going to have to make the decision if you want to go on to Cobra first, ACA first, but in all likelihood, you might end up doing a combination of both Cobra and ACA. A lot of times, what we'll see in that situation, if you retire young, is going on to Cobra immediately upon retirement for the rest of the year in which you retire, staying on Cobra, and then making the decision at the beginning of the end of the year to either stay on Cobra or go on to ACA at that time. Now, how if you Snowbird? How if you're a Canadian tax-paying resident and you have Canadian health insurance, but you're spending 4 or 5 months down here in the US? You have a couple options available for you. If you are a US citizen, and only if you are a US citizen as a Canadian resident, you can maintain Medicare down here in the States. Again, that's only available to US citizens. If you were a green card holder down here in the States, you moved up to Canada, gave up your green card, you can no longer keep Medicare if you move down here to, or if you snowbird down here in the States. What most of our clients will do if they snowbird, they end up buying a travel insurance policy up in Canada that will help them qualify or help them have some insurance while they're down here in the US. As you can see, health insurance can be pretty complicated. There's a lot of options, there's a lot of moving parts. Certainly, this new administration, there's going to be some even more moving parts over the next year or two as well. We specialize in helping people with this cross-border financial planning. If you're interested in retirement, if you worked up in the US and Canada, we help simplify that. And this is one of the things that we go through with all of our clients, is to help them understand what's the best healthcare options available for them in retirement. You can schedule a complimentary consultation at our website, retirementin.com. Thanks everybody for listening today. Bye now.